Hi everyone, welcome back to the channel. I'm Dr. Pore Pop, board-certified facial plastic surgeon, and the founder of Cummed Skin. I specialize in facial rejuvenation, which means I help people look as vibrant, energetic, and youthful as they feel on the inside. Today's video is something I'm incredibly excited to share with you. This is not just about aesthetics, it's about restoring confidence, reclaiming identity, and helping people feel like the best version of themselves again. You're about to watch a series of real patient journeys, before and afters, surgical insights, and recovery highlights, all showcasing our signature procedure, Vertical Restore. So sit back, relax, and enjoy as we walk through these powerful transformations. Let's get into it. Case study number 1. A subtle yet stunning change. In her before, you'll notice a soft heaviness in the lower face, slight jowling, volume loss around the cheeks, and a tired expression that doesn't reflect how vibrant she truly is. Olivia's transformation was all about restoring structure. We performed a vertical restore with fat transfer, carefully repositioning her facial tissue in an upward vector, not pulled back, but lifted vertically, naturally. We also did a subtle lip lift to refine proportions, and a conservative volume restoration in the mid-face. Look closely at the after. The crispness of the jawline, the brightness in the eyes, the renewed definition around her mouth. It's not just a facelift, it's a facial rebalancing. Case study number 2, genetics versus aging, breaking the cycle. Now Linda is a fascinating case, because her jawline and neck never had that sharp definition, even in her 20s. It wasn't just aging, it was genetic fullness. But even genetic challenges can be addressed with the right technique. What's critical here is that we didn't remove her submandibular glands or touch any deep musculature. Instead, we restructured only the superficial fat compartments and lifted the entire soft tissue plane in the correct vector, vertical, not diagonal, not horizontal, but in line with gravity's effect, reversed. The result? An elegant neckline she never thought possible, natural, long-lasting, and above all, safe. Patient diary, 1-week recovery timeline. Day 1. I just had surgery yesterday, and honestly, I'm surprised at how little pain I'm in. Day 2. A bit more swelling today, but I can already see my jawline changing. Day 4. Bruising is fading, still a little tender. I'm resting a lot. Day 6. I actually feel like going for a walk today. I saw myself in the mirror this morning, and I cried. It's me. Day 7. I can't believe it's only been a week. I feel lighter, younger, more me. Dr. Pore Pop, voiceover. Recovery varies from person to person, but our minimally traumatic approach makes healing predictable and easier than most people expect. That's the vertical restore difference. What happens during surgery? Let's break it down. The face ages in predictable zones. The brow descends, the mid-face hollows, the jawline blurs, the neck bends and folds. And yet many facelift techniques only address 1 or 2 of these, or pull in the wrong direction, creating that tight or wind-blown look. With vertical restore, the entire soft tissue layer, called the SMAS, is lifted en bloc. This means we're not separating the zones. We're moving the face as one harmonious unit. We also preserve nerves, glands, and vascularity, keeping safety and longevity in mind. Case study number 3, mid-face volume and proportion balancing. Emily came in, feeling that her face had become square and tired. What was really happening was mid-face deflation. We restored her natural cheek prominence with a gentle fat transfer, not overfilled, not obvious, just supportive. We also performed a small brow lift, which completely transformed the energy of her expression. No more tired eyes, just light and life. Her after shows not just a more youthful face, but a happier face. Educational segment, why looking tired isn't just about sleep. Why do I look tired even when I'm well rested? It's not your imagination. As the soft tissue of the face begins to descend, the eyes and mouth areas often sag in subtle ways. The corners of the mouth may turn down. The upper eyelids begin to shadow the eyes. The cheeks lose their upward volume and cast deeper shadows. This combination sends a message to others and to yourself that you're exhausted, even when you're not. Vertical restore isn't just about reversing wrinkles. It's about reversing facial messaging. We're restoring how people read your face and how you read yourself. Now let's look at Richard, one of our male patients. Men are often nervous about looking done, but Richard's transformation is proof that you can restore a masculine, youthful contour without any sign of surgery. Notice how his neckline went from indistinct to clean and sculpted, but the skin still looks natural. There's no tightness, no tension, just healthy structure and better definition. No over-pulled sideburns, no distorted earlobes, just confidence. These transformations are not just physical, they're emotional, they're personal. Every patient you've seen today made the brave decision to trust us with their face and their story. And every one of them reminds me why I do this work. Thank you so much for watching. If today's video inspired you or made you rethink what's possible with modern facial rejuvenation, let me know in the comments. I read every one. We'll be sharing more journeys, more education, and more insights on how you can age confidently and gracefully while still looking like you. Until next time, take care of yourself, and remember, you don't have to settle for looking tired just because you feel great. Let your face tell your story the right way. I'm Dr. Pore Pop, and I'll see you in the next one. Don't forget to subscribe.